like if we're getting a lot of good questions, but if not, then once we've addressed most things, we can wrap up. Do you guys want me to count myself in? How do you want me to do it? Okay, I'm just trying to find I want to get to I got to find where's here we go.
Do I look like I'm sitting?
Hi, everybody. Welcome. We have Dr. Stephanie Wright. She is the Assistant Director of Infectious Disease at Hartford Healthcare. And thank you for joining us for this Facebook Live this afternoon. I know some of you are going to be just getting on the feed. Feel free to share it with your friends. I know there's so many questions about the coronavirus, which is why we wanted to do this, to speak with Dr. Wright about so many of the questions that are going around, because honestly, it seems like people are quite upset, a lot of anxiety, sure. And hopefully this conversation with information might even allay some fears. Sure. What can we say right now about the coronavirus and how fast it's spreading?
Well, we know that it started in China, that for a while it looked like it was staying in China in Hubei province. And we now know that it has moved on from there, first to Southeast Asia, a number of countries there, and now to Europe. And even we have some evidence that we have some a case of community spread in the United States.
Right, and I was reading that it is on every continent except Antarctica. So at first we were just all worried about people coming from China. Now we're noticing Italy, some places that are quarantined in Spain. Is it safe to say we are going to have to deal with this in our community?
I think we are going to have to deal with it in the United States on some level. Whether we will deal with it in Connecticut or we will deal with it in a number of different states throughout the country, that remains to be seen, but we probably are going to have some more spread.
I think people were concerned when the CDC said to all the communities, dust off your pandemic plans. And people hear pandemic, and I think that raises the anxiety. What is a pandemic, and what does it mean? Because I know you are working with your pandemic plans.
Sure. So a pandemic is a widespread of a disease that is transmitted person to person and causes serious disease and causes it over a number of different areas in the world. So organizations such as the World Health Organization and so forth make a final recommendation of when they think something has reached pandemic proportions. Mm-hmm. But clearly there is widespread virus infection with COVID-19 throughout the world.
And this seems to be something that people are getting infected quite easily. Some of the information I was reading is that it seems to spread quickly among the human population.
Well, it's a respiratory virus, and respiratory viruses, we all are familiar with things like the common cold, rhinovirus, and actually there are a number of different coronaviruses other than COVID-ID that circulate around in the human population that cause cold-type diseases. And when you think of the cold, you think of it being easily transmissible. And basically, these diseases are spread when you cough or spit, or sneeze, and droplets come out of your orifices and get on to the eyes, the nose, or the mouth of someone that's within 2 meters or 6 feet of you.
So we can understand people being concerned because it's spreading quickly. We're talking about words like pandemic, but you were saying it's important to recognize that just because the coronavirus perhaps will become a pandemic doesn't mean that it'll be this huge deadly pandemic. The survival rate of the coronavirus is quite high. Some people only experience cold-like symptoms, right?
That's right. In fact, the vast majority of people so far have recovered from the illness, and some of them don't even require hospitalization as they're supported in getting better through the illness. It is true, though, that especially persons who are older, persons who have underlying diseases such as heart disease, lung disease, diabetes, cancer, and other immunocompromising conditions would be more likely to get severe disease and more likely to need hospitalization and intensive care services.
So, in fact, we had some questions, which if you are joining this Facebook Live right now, we are here with Dr. Stephanie Wright. We're talking about the coronavirus, everything we need to know, so people can really have a good understanding. We welcome your questions and comments below. Feel free to share this so that your community can get involved in the conversation. One question that we had was, should people with asthma be more concerned?
I think asthma is an underlying lung disease, and yes, I would be careful and use the best respiratory etiquette you can. Coughing into your arm, if the crux of your elbow, if you have symptoms, cold-like symptoms, distancing yourself by 6 feet to 2 meters from people who are sick, and just trying to make sure you wash your hands well, wash your hands after touching surfaces before you bring your hands to your face. Those are the types of
What about the masks? We are doing stories about how masks are selling out. We understand that this is, you're saying the droplets are how people are being infected versus it's not just an airborne virus. So is it really necessary for people to have masks?
We put masks on people who we think have the disease to try to control the droplet release.
Yep.
For people who do not have symptoms and who do not have the disease, the mask is not going to protect you.
So walking around with a mask is not going to prevent us from getting the coronavirus.
Right, that's correct.
Okay, so we're seeing them sell out. How do they test you for the coronavirus? How do you know? I mean, let's say you're local and you're sick. It's going to be on everyone's mind. Should we be tested, and how do they do that?
Sure. Well, important now in evaluating people is, of course, the symptoms of cough and shortness of breath and fever, and also the travel history. And recently, the CDC has amended its definition of who should be considered as a possible person who might have coronavirus to include countries in addition to China of South Korea, Japan, Italy, and Iran, where there has been known community spread of the disease. So persons certainly who have traveled within the last 14 days, which is the incubation period of coronavirus, to one of these countries and have symptoms such as cough, shortness of breath, and fever would be people who should consult their practitioners, their healthcare practitioners, regarding the question of whether they should be tested.
Okay. And I was just reading the other day that they had the first case in California where they have no known connection to travel. And that's just because people are asking, is it likely that we're going to have this spread to Connecticut? I know that's a crystal ball question, but it is spreading in all areas of the world.
It is certainly possible that we're going to have it spread here. I think it's hard to know whether it will or not.
Okay. What are the symptoms?
The symptoms would be cough, fever, and shortness of breath. And people could have more mild symptoms such as fever and achiness.
Okay. So very much like a flu or a cold.
That's right.
Okay.
That's right.
So a lot of folks have planned vacation for spring break, and there are folks that are maybe traveling to Mexico, Aruba, or to Europe. What is your advice about leaving the country to these places?
I think there's very good guidance on the CDC website about countries that are considered to be at risk, where you might want to consider whether you would want to continue your travel to those countries.
Mm-hmm. So right now we have that list of countries like China and Iran and even Italy. But if, say, you have a trip booked to Spain or France or anywhere in Europe, we know that this is escalating as far as what is it going to be when you actually leave in April. Other countries could end up on that list, yes?
Right.
And the whole idea of people are concerned about going through major international airports.
Sure, sure. And that is a valid concern. I think, nobody has a crystal ball. I think you have to do what you feel comfortable with.
Mm-hmm. And just for the viewers who are watching, I was researching a little bit. The New York Times had an article about travel insurance, which I know is not your domain, but fear of travel is not usually a reason for people to have that enacted.
Sure.
However, if there are exact lists, but the CDC has to see exact numbers before they put countries on a list? Is that how it's done?
I'm not sure how they decide when a country goes on the list. It probably does have to do with the number of cases in that country and maybe the degree of spread that they're noticing in that country.
Someone is asking, I heard there's someone from Bristol with the coronavirus. How true is this? Do we have any legitimate reports of coronavirus in Connecticut?
That I know of, we have no cases in Connecticut, but there's always the possibility that someone somewhere is being evaluated and recommended for testing, and that's usually done in coordination with your own healthcare provider and calling the DPH to help make the decision of whether the patient should be tested.
As someone who is working with infectious disease, and you're very up on what needs to be done at Hartford Hospital, all that, if people are going to their regular doctors, is it being advised that people get tested for the coronavirus? And can we rest assured that communities are going to be part of a plan? They'll know if they should be testing?
Yeah, I think that's a very good question, and I'm not sure we have the total answer to that. We know that people who have visited certain countries within a certain time period of the 14 days, and have symptoms that we've discussed earlier, those should be considered patients that would be tested. Whether people who do not have those risk factors, or who among people who do not have those risk factors should be tested, I think is a hard question that's undergoing evaluation daily by authorities at the CDC and other healthcare organizations throughout the world to try to make that decision, because this is, after all, flu season, and
so
it's also a
season flu,
right? And there are many more cases, probably, of flu and other respiratory viruses going around than there are coronavirus. So that becomes very complicated, in truth.
So some are saying it has to be worse than the flu with all the fuss they're making worldwide. Why is there, to kind of cut through the hype,
Sure.
Why is there so much fuss over the coronavirus versus influenza that we all know about?
Sure. Well, I think part of it is that it's new. And another part of it is that there's a lot we don't know about it. Certainly flu right now, for example, is a much bigger problem in the United States than coronavirus is.
Okay.
However, flu has a mortality rate of about 0.1%. The COVID-19 virus has a mortality rate of 2%. That's still not as high as the mortality of, for example, Ebola, which is put at least 50%. But it is higher than the flu mortality. There is a spectrum of illness, and there is the potential for people to get very sick, although most people will not get very sick and will recover.
So that's what we really need people to understand. I think people hear on the news, coronavirus, death toll, and think if you get this, you're going to die. Very important that people understand. Most people will not have that severe complication of the coronavirus. In fact, we're seeing if people are traveling with children, I know this is a concern about the kids, at least with children, for whatever reason, they seem to be not getting this virus nearly as much as adults.
Right, yes, and I don't think the reasons are understood for that, but I guess that's a good thing.
Yeah, I mean, so just for people to know, and as you said, we don't have all the answers about this. The big concern, though, for the elderly people or people with compromised immune systems, that's where we have seen really some severe complications from this.
That's correct. That's correct. They have higher rates of getting severe disease, and there are higher rates of mortality.
We're going on a cruise in just a few weeks. Should we be worried?
I think depending on where you're going, if you were going to one of the countries that's on the CDC's list, I would be carefully considering whether I would go or not. Yeah. For other countries, I think it has to be a matter of your comfort level. We know this is going on. Your comfort level of how worried you're going to be. Are you going to be able to sleep at night? Are you going to be able to have a good time? Are you going to? If not, then maybe it's not something you should do.
The other thing that people have to be concerned about is we're seeing that when people go to an infected country, and sometimes we're finding out that a country gets on the radar list within days. And then they're being quarantined, right? They're not allowed to come back
That's
into
correct.
this country, or they're being held at their hotel.
Sure.
So that is a risk for people. We can't really predict how it's going to spread, or if you might experience a quarantine if you're going overseas.
That's correct.
So that's a big concern for people who have work and school, or what do I do
agree.
if I'm, because how long, the quarantine period is generally a minimum
14
of
days.
14 days.
Yep.
Okay, so that, someone is asking, what about flying? Shouldn't a mask be important to wear if you have a compromised immune system if you're on a plane?
Again, the mask is helpful in preventing someone who has influenza or COVID ID or some other diseases from spreading droplets around to get other people sick. Wearing a mask is not particularly helpful for the average person that's walking around to prevent them from getting the disease.
So people are asking also, we all are in the world of online shopping, right? And lots of packages come in from China.
Sure.
Do we have to worry about packages coming from overseas?
Sure. I haven't heard anything as to that. What this probably runs into the question of fomites and having virus perhaps on inanimate objects, which could include packages arriving from another country. And I think that we don't know all there is to know about that for this virus. So at this time, I don't think there's any particular risk that's been identified with receiving those packages, but I think that how much transmission occurs from fomites is an ongoing area of investigation.
So for those who are joining the feed, and perhaps you missed the beginning, we are here with Dr. Stephanie Wright. She is the Assistant Director of Infectious Disease with Hartford Healthcare. And for the average person, I think this is really important just to keep getting this message out. People are saying, what do I do? If you're a regular family out there with kids and wondering how to protect yourself and your family, and you don't know of any of these really high risk factors, just how should we in general be behaving here in Connecticut?
Well, I think we should stay home if we're sick. I think if we have symptoms and have a cough or a sneeze, we should cough into the crux of our elbow, or we should use a Kleenex when we sneeze, and then dispose of it appropriately in a bin, and wash our hands well.
So do you think 14 days is enough time for these quarantines, or do you think that the quarantine should be longer? Someone has a question about that.
Well, from the information we have so far on this COVID-19, it looks like there's pretty good data suggesting that the incubation period is up to 14 days for developing the symptoms. Actually, many people will develop the symptoms around 5 to 8 days, but the outside of 14 days is a pretty good number as of this time that's been established. So I don't think that there's evidence to suggest that it should be extended beyond 14 days at this time.
Someone's asking, what if you have a job where you come in contact with hundreds of people? You're just someone who, maybe like doctors who work, but what do you do if you're someone who, through your life, you're just going to come in contact with lots of people right now?
I think you use good respiratory etiquette, and you use good hand hygiene. That can't be overestimated.
These simple acts of washing our hands.
And for a number of different. Purell is good. You want to make sure that you get enough Purell on the hands. You want to make sure that you rub the surfaces of the hands together until it dries. The other option is to hand wash with soap and water, and hand wash for 20 seconds and dry your hands well. Okay, so a lot of us often don't wash our hands appropriately. So you want does it matter if the water's warm? I don't think it really does. As long as you have the water and the hand, and then they say you should be singing like happy birthday. Like really get really, not the kind that people just rinse their hands and walk away. That's right. We want to make sure. I know there's a lot, and I want to make sure that we're so grateful that Dr. Wright is here with us, and she acknowledged in the beginning of the Facebook that there is a lot that experts, even like yourself and the CDC, just don't know about this, and perhaps that's the fear around it because it's so new. But for now, it's important to say that it is much like people are asking, is it like a regular flu virus? And sounds like, from what you're telling me, In many ways, it is like a regular flu virus. Yes, that's true. Yes, it's certainly like that, and certainly for the majority of people who get this disease, they will, with supportive care, improve and resolve their infection. For people who have underlying illnesses or are older, at the extremes of age, it could be a much more serious illness. Someone else, Joanna, is saying, I am traveling in May to Italy, which we know is on the list. Should I wait to see if it gets worse? I think she means before she cancels, or based on what we know right now, if you were advising your patient, would you ask her to stay home? Well, I don't know where you're traveling in Italy at this time. The cases that have occurred in regions of northern Italy. But it's hard to know, is it spreading southward? I mean, we just don't know where this virus is going. We don't know where it is. So where it's going to be going and how fast it's going to be going there, if it may be contained in the 5 regions that it's in by the measures that they're taking. But it's hard to have a crystal ball on that. Someone else is asking, what do we know about animals catching? We do have some preliminary information that perhaps this virus was spread from a bat, which I guess a lot of viruses come from bats. I'm learning from reading the articles. Yes, that's true. Other viruses than rabies come from bats. Okay. Right. So, but what about regular cats, dogs, horses? Do we need to worry about our animals? Right. I don't know of any evidence that we have that clearly shows that animals are carriers of this virus. Okay. So what if you don't know if the person sitting next to you on a plane doesn't know they're sick? And the other question that came out like this is, could a person who has no symptoms also be a carrier of coronavirus? I think there's really active work ongoing to see how many people are asymptomatic and have this disease, and whether they can actually transmit it to other people in the asymptomatic stage. I don't think that's something that's been well worked out yet. So most of us, even if we have a really healthy immune system, would have some sort of a symptom if we had a virus like the coronavirus. I think that we definitely know. What we do know is that people that are symptomatic and coughing out, sneezing out, droplets are going to be definitely the sources that are potential for infection of other people. Okay, and if you're just joining the feed, again, a lot of people in the beginning were asking about masks, and the doctor explained earlier that all of us running out to buy masks is really more fear-mongering at this point, because the masks are really only useful, sometimes recommended by a doctor for a person who is actually sick to prevent them from putting droplets out. But me, the person on the street wearing a mask and walking around, isn't really going to protect us. That's correct. Okay. Is there anything that you think is important as people are listening, and we have several hundred people who have a lot of questions right now who, it's a big topic that obviously people are concerned about, with schools even, like, is there special concern for what the schools should be doing? I think that one of the greatest things we have about this is that we're not alone as a family, as a person, as a town, as a hospital. We're in this together, and we have great public health resources in the state of Connecticut, as well as at the CDC. And I think that they will provide us guidance as to how to proceed depending on the number of cases and that occur. For example, if there are no cases in an area, such as right now we know of no cases in Connecticut, there probably wouldn't be much point to shutting down school systems or telling people you shouldn't go into work, you should only work from home. Whereas if there's a number of cases, and especially a large number of cases in another area of the country, then the recommendations might be different. It depends on the situation that's occurring. So I think we need to take guidance from the state government in Connecticut, who's preparing, and we are all planning as healthcare organizations in Connecticut and across the United States. We definitely, certainly at Hartford Healthcare, are developing strategic methods to deal with this situation, and I think we have to see how things develop.
I wanted to go back to one question that I don't think we got to answer was, how are we tested for the coronavirus? How do they test you?
Sure. The way you're tested is they take a swab, a viral swab, and they actually put it in each of the nose holes, the nares. It has to go up a little bit high in that area. Sometimes you might, your eyes might water slightly when this happens. And then a separate swab is used to swab the back of your throat. A lot of people have experience with having had tests for strep throat where they put they test the back of your throat. And again, a lot of people will gag a little or cough. We want deep samples like that. And then in addition, we want a blood sample. And then those samples are forwarded to the testing facility to get the test done.
Are there testing facilities here in Connecticut?
Up until now, the predominant place to send the testing to was the CDC. Fortunately, we were just informed in the last day that the state of Connecticut has the tests and that we'll be able to be getting testing done at the state of Connecticut lab, which should help aid in the turnaround time for the testing.
What is a typical turnaround time?
Well, I think the turnaround test time for the CDC has varied somewhat, but it has probably been in the realm of about 3 to 5 days. Okay. And again, hopefully, and again, they're just starting out with this testing here in the state of Connecticut. Hopefully, we'll be able to bring down the number of days needed to get a test result with the fact that we're able to do it now in the state lab.
And then in case of an infection, what should I do? Should I stay home or seek care? How do you know if you even need to go to the doctor? Because sometimes with a cold, we do just drink fluids and rest the way your mom taught you to.
Sure. Yeah, I think if you're sick, if you're not feeling well, you should stay home. And that's from the point of view of a number of different, we shouldn't be spreading regular colds. We shouldn't be spreading, measles. We shouldn't be spreading chicken pox. We should stay home if we're sick. That's always good. If you're sick and you're having concerning symptoms, then that's the time to call your healthcare provider and get advice as to what are other steps that you should take. Should you go in and be seen? Should other testing be occurring?
I don't know if you know the answer to this, and some of you might get a chuckle, but it's a real question that people have. Why did they name the virus Corona? Some people are thinking it comes from drinking Corona beer. Obviously, that's not the case. Yeah. You don't need to worry about that.
I've heard that joke, and I think it's a very creative and good joke, I must say. It's called coronavirus because of glycoprotein spikes on the surface of the virus that when you see them under the electron microscope, all these spikes sticking out from the virus, it looks like a corona, like the corona, the sun corona that you see.
Okay.
And so that's, I believe, why they're called coronaviruses.
Okay. So I think we're going to be wrapping up soon because I think we've answered most of people's questions. But I just want to, if you've been watching at this point and didn't get a lot of information, you can go back in the comments and you're going to see a lot of things answered. But the main message that you have for people is that it's very possible this will create a pandemic by CDC definitions. But pandemics don't always mean that they're deadly. You said, I think, the 2% mortality rate. Right. So a lot of people will get the coronavirus, and much like the flu, they won't feel well, but they will recover.
That's correct.
Okay. Anything else you think it's really important to inform people, since there has been so much curiosity and misinformation?
Sure. I think it's always important, you bring up the misinformation issue, and it's always important to try to educate yourself, and sites that have a lot of good information on them would be the World Health Organization site, the CDC website, www.cdc.gov, and there is some information also on the state of Connecticut website as well.
Okay, and I know a lot of you keep asking about canceling spring break plans, and I know, I gather it's sort of an individual decision.
Right.
But as you look on the CDC websites, you can at least see the countries, you can see the threat levels. What we don't know is what will be the threat level for a country in 5 days from now or 10 days from now, because this is evolving so rapidly.
Well said.
Okay. Dr. Stephanie Wright, thank you so much for taking the time. I think we've answered a lot of questions here, and appreciate everyone who is on the Facebook Live feed. And if you want to share this with your friends and family so they can feel informed, this video will live on so you can listen to all of the doctor's comments from the very beginning if you play back the video. Thank you.
Thank you for having us. I really appreciate the opportunity to come and speak, and It's been nice.
Yeah,
working with you.
absolutely. Yes, and see, we both of us are healthy, so there's no reason not to be shaking hands
That's
and being
right.
kind to everybody. All right. Thank you, everyone, and we will see you tonight for Eyewitness News starting at 4:30.